everyone, it's Tiffany, and my topic is pedophilic disorder. So before I get started, I just wanted to provide a disclaimer. This content may be difficult for some people to listen to or to read. If you feel triggered in any kind of way, please feel free to reach out to John Jay's Help Center, the Wellness Center. They do have free on-site counseling, and I've provided a link below that you can click to get those services directly. So the DSM-5 diagnostic criteria for pedophilic disorder, criteria A, the individual would have to experience 6 months of recurrent, intense, sexually arousing fantasies, sexual urges, behaviors that may involve sexual activity with children who are younger than 13 years old. So those are prepubescent children or children that have not hit the stage of puberty yet. The individual has acted on those sexual urges or fantasies and they cause distress. The individual has to be at least 16 years old or 5 years older than the child listed in criteria A. So 5 years older than at least 13 years or younger. So just a little review of pedophilic disorder. It's a disorder in adults that experience sexual urges, fantasies, and behaviors toward prepubescent children. They're sexually aroused and they have sexual interest in children. And they can also act on those behaviors. So again, with pedophilic disorder, the individual has to act on those urges or those fantasies. There has to be some type of sexual behavior between the individual and a child to be diagnosed with pedophilic disorder. Moving on to the course and prevalence of the disorder, pedophilic disorder generally begins in late adolescence or in early adulthood. It can be considered a long-term disorder if the individual experiences consistent sexual fantasies, urges, and behaviors for a period of time. So if the individual starts experiencing these fantasies in late adolescence and they choose not to speak about it due to any type of stigma, it can be a long-term disorder, again, just because the individual has kept it more like a secret. So not all people who are diagnosed with pedophilic disorder engage in harmful behaviors. If they don't receive treatment, the risk of reoffending does become greater. So then going back to those who are diagnosed with pedophilic disorder, not everybody engages in sexual behavior with children. They wouldn't be technically diagnosed with pedophilic disorder because again, they would have to engage in some type of sexual act with the child. Treatment can lower the risk of reoffending and prevent further harm to other children. So the prevalence of pedophilic disorder is unknown. This is due to underreporting, social stigma associated with the diagnosis and the secretive behavior. So as I mentioned earlier, the reason of it being a long-term disorder is due to these factors. So because people don't want to report it due to the social stigma associated with the diagnosis or they choose to keep it a secret. It is less likely than 3% in men, according to an international study, and less than a fraction of that in women. Again, this is just assumption for the prevalence because it is overall uncertain, especially uncertain in women. For the prognosis, individuals who seek treatment voluntarily have a better chance of being treated. The factors may include high motivation and actively seeking treatment. Early intervention is important so they can receive treatment and limit the amount of children that can potentially become victims. Those diagnosed with pedophilic disorder need constant treatment to avoid relapse. So they need constant treatment and constant supervision as well. They should be monitored. The prevalence because it is overall uncertain, especially uncertain in women. For the prognosis, individuals who seek treatment voluntarily have a better chance of being treated. The factors may include high motivation and actively seeking treatment. Early intervention is important so they can receive treatment and limit the amount of children that can potentially become victims. Those diagnosed with pedophilic disorder need constant treatment to avoid relapse. So they need constant treatment and constant supervision as well. They should be monitored, and as they're receiving treatment, this would be cognitive behavior therapy, any medications that are being prescribed to them. During therapy, they're also learning to identify potential triggers and then strategies to reduce the possibility of reoffending, as well as coping mechanisms. Some cultural considerations for the diagnosis. Different societies may have different age of consent laws as well as cultural norms in regards to sexual behaviors and relationships. An example of this can be arranged marriage that can begin as young as 12 years old, as well as here in the United States. As long as you have a parent present, any child can get married to anybody. It's just a parent, if they're under 18, the parent would have to sign the marriage certificate for the child, stating that they are allowing their child to get married to either to an adult. Again, in some societies, that's accepted. As I mentioned, it does happen even here in the United States, as well as other countries that do have arranged marriages. And for those countries, it's more of like like a survival mechanism, where they're arranging a marriage is because their son or daughter is marrying into a family that's able to provide their family whatever good they need to survive. This is considered pedophilia, but again, there are some loopholes here in the United States when it comes to that. As I mentioned, if parents provide consent for their child to get married to an adult, it's not considered pedophilia because the parent is knowingly providing consent for their child to get married to an adult, and therefore is legal. Some cultural factors may impact mental health services and special treatment for pedophilic disorder. So a few kinds of assessments for pedophilic disorder include clinical interviews. So this is interviews, open-ended questions, closed-ended questions with a therapist regarding the individual's fantasies, their sexual interest in children, it also includes their sexual history. Another assessment is psychosocial history. They do psychological testing, risk assessment, and then as well as cognitive behavior assessment. So the differential diagnosis for this disorder is pedophilia. This is individuals that experience recurrent, intense, sexually arousing fantasies or sexual urges involving sexual activity with prepubescent children. But the key factor of this one, again, is they do not act on those urges. So they can have fantasies, they can have urges and things like that, but they do not act on those urges. They do not engage in any sexual activity with prepubescent children. Other paraphilic disorders are individuals who expose themselves to children may be evaluated for pedophilic disorder. If the individual exposes themselves to children consistently, they may have both exhibitionistic disorder and pedophilic disorder. Antisocial personality disorder, substance intoxication. Substance intoxication is interesting because it can increase the likelihood that an individual is attracted to adults and may sexually approach a child. Again, this can be due to them being under the influence of any particular substance and may confuse a child with an adult, or it may be because the child is just an easier access and not really because there's a sexual interest between the individual and the child. It's just mainly they're under the influence of whatever substance that they're using. Obsessive compulsive disorder. The individual may express obsessive thoughts about attraction to children that can create worries. Clinical interviewing reveals an absence of positive thought about attraction to children, and there's no connection between sexual attraction and sexual thoughts towards children. So this one is just more about having like sexual thoughts about children, but then like having that immediate worry, like, could I possibly be a pedophile, and just having those worrisome thoughts that become obsessive, that the individual starts to obsess over. but there is no but the individual does not feel any sexual attraction or any interest sexually towards children. The etiology factors can be biological, psychological, and social. Research in the neurobiological factors have shown abnormalities in the frontal cortex and the limbic system that is associated with impulse control and emotional processing. Experience in childhood, including child abuse, is also considered a factor, but not everyone who experienced child abuse as a child develops pedophilic disorder, as well as personality disorders. Not everyone who is diagnosed with OCD will develop symptoms associated with pedophilic disorder. So I found a case regarding an individual missing was by Mr. N, who was a 55-year-old male who had been experiencing sexual interest in both boys and girls. He had sexual urges, fantasies, expressed arousal while being around children, but his behavior would be more like caressing and touching children. In his period of time, he had been caught by colleagues and other family members as well, but he convinced them somehow not to say anything. So he, in the long run, ended up getting treatment and counseling with his wife. He also had a family. So he was made aware of the dangers that could happen if he didn't continue counseling, meaning that he can get arrested and be registered as a sex offender. He received an MRI and was put on medication for antidepressants as well as iroxine. And then he received support therapy as well as behavioral therapy. And with all this treatment, he was able to go back to his normal self without any thought, feelings, or urges of sexual interest in children. So with this case, this is proof that with consistent and long-term treatment, individuals that may have been diagnosed with pedophilic disorder, as long as they're also continue to be monitored as well, they can be treated of this disorder. So that's it for my presentation, and these are the resources that I use. Again, if any of this was triggering to anybody, I do have the link for the Wellness Center and the counseling services. Thank you.